So a hernia is a weakness in the abdominal wall muscles or fascia. It's caused often when we get older, our muscles and tissues become less elastic. It's often caused by professions that use a lot of force or exertion, and so you get a bulging when you have a weakness in the abdominal wall muscles. So if you've got a very strenuous job like a labourer, plumbers, electricians, when they do lots of heavy lifting, they can push through a weakness, and the common weaknesses are in the groin or in the abdominal wall. The first symptom that often people get before they get any lumps is they find a pain or a sensation where the hernia is. So in groin hernias, some patients often feel a burning or a pressure before they feel an actual lump. And in the abdomen, they often feel some pins and needles or sharp pricks where a hernia is about to develop. So they're the early signs. And then obviously when you see a lump, you know that there's something bulging out. Often it's worse if you cough. So if you cough and the bulge gets bigger, then that confirms that it's a hernia. So those are the main symptoms. So a strangulated hernia is a dangerous type of hernia. It's when you have either a piece of bowel or a piece of intra-abdominal fat that bulges through and then gets incarcerated, or it's stuck where the hernia is. And it's then strangulates when the blood supply to either that piece of bowel or that fat becomes compromised. And so there's often either a twist where you have the hernia, and that then cuts the blood supply off. If it's fat, then it just gets a lot of pain and it's really painful. Sometimes you can get an infection developing in that, and patients often come to hospital. But if it's bowel, that's really dangerous. And actually the bowel can only survive about 4 hours without some blood supply. And so it's really important that a patient with a really acutely painful hernia that's strangulated comes to the emergency department so it can have emergency surgery. Yeah, there's lots of different types of hernia depending on the weaknesses in the abdominal wall. So if you think of the abdominal wall where your six-pack is, you can have anything along where your six-pack is. And then the commonest hernias are in the groin, and those are called inguinal hernias, and we'll talk about those later. So they're the common hernias. You can have really rare hernias either in your back, in your lumbar region, and those are really quite rare. And obviously patients who have lots of reflux can also have hiatus hernias, but those are not hernias of the abdominal wall. That's up in the diaphragm. So in chaps, in men, if a hernia isn't symptomatic, it's not giving you any pain, and it's not giving any symptoms, then we often advise the patients that if they're small hernias that's not giving any problems, we don't fix them, because any surgery carries a risk. There is a very small risk that you can cause scarring or hematoma, that's a collection of blood or fluid. And there's a small risk in groin hernias that you can cause chronic groin pain in between 2 and 5%, depending on the technique that you use. So it's not imperative that you have a hernia fixed if it's not causing you any symptoms. If it is causing symptoms and you ignore it, it will almost certainly get bigger over time. And hernias are easier to fix when they are smaller, because you don't have to do as much dissection. The mesh doesn't have to be as big. And actually the complication rates and pain post-operatively is less if the hernia is small. And then lastly, if you ignore a hernia and you've got a piece of bowel in there, then it could become incarcerated and strangulated, and that is dangerous. So a hernia can be treated conservatively with an implement or a truss a garment that pushes the hernia back inside. And in patients who are really unwell, with lots of medical problems that can't have an operation, then that's what I would normally advise. But for patients who are fit for surgery, there are usually two options to fix a hernia. There's an open approach where we make a cut above where the hernia is. So where you feel the hernia, you make a cut over where the maximum bulge is. And there's also keyhole methods where you put little ports inside the abdomen and you fix the hernia from inside the abdominal wall. And that's a minimally invasive approach. And that's something that I do for most hernias, especially groin hernias, as it has less pain and quicker recovery from surgery.